what is the mechanism of manifestation of Vata Pitta disease? How to understand the mechanism of pathological events in Vata Pitta disease? How to understand the Dvandvaja manifestation of the disease? This is the topic of discussion in this particular video. Dear ANA community members, press the like button and spread this particular video to maximum number of true Nidana learners so that we can make a huge movement out of this particular small message. Don't forget to press the bell icon so that the YouTube algorithms will be fetching the right information at the right time for the right purpose. When you think about the pathogenesis of Vata Pitta diseases, so here it is considered to be a little bit the manifestation is related with the vitiation of the two dosha or two bioenergies. Naturally, in most of the occasions, we are not going to get the single dosha vitiation of the diseases. They are comparatively rare. Whenever we think about the manifestation of the diseases, most of the occasions we are going to observe the vitiation of the any two dosha. Either there may be Vata Pittaja manifestation, or there may be Vata Kapha vitiation, or there may be Pitta Kapha vitiation in the body. In this particular video, we are going to discuss about the Vata Pitta diseases pathogenesis. When you think about the pathogenesis of the Vata Pitta diseases, it is comparatively difficult to identify. But we can able to make a possible hypothesis for the Vata Pitta pathogenesis of the diseases. So here, Ashtanga Hridaya says, Dvandvam to Sankara. In the sense, there will be the exposure to the Nidana, so that may be responsible for the vitiation of the Vata Pitta diseases here. It is being mentioned in Arunadatta commentary, Dvandvam Dvayam. So here, Vata Pitte, Vata Kapha Pitta Kapha Viti, Sankara, Mishri Bhava Tiktadina, Utpyati. Etaduktam Bhavati, Yena, Tiktadi, Vata Hetu Sevitaha, Katvam Ladivischa, Pitta Hetu Tasya, Vata Pitte Pratupyataha, Evam Shesha Yogu Yojam. So in the sense, there will be the vitiation happens because of Tiktoshana Kashaya Paruksha Pramita Bhojanaihi, Dharanudhiran Nisha Jagaratyucha Bhashanaihi, Kriyat Yoga Vishoka, Chintavyayama Maithunaihi, Grishma Ratri Bhuktante Prakupyanti Samirana. These are the Nidana which are responsible for the vitiation of Vata dosha. Whereas vitiation of the Pitta dosha that is being mentioned, Pittam Katvam La Tikshnoshta Patakrodha Vidahi Vihi Sharan Madhyana Ratriartha Vidaha Samayeshuja. The person will be having the vitiation of the dosha because of the exposure to Nidana, which may be responsible for the Vata dosha vitiation as well as Pitta dosha vitiation. When you think about the pathogenesis understanding, it is a difficult process, as we have discussed earlier. Still, we are going to make an attempt to understand the mechanism of pathogenesis of specifically Vata Pitta dominant diseases. From the point of Panchamahabhuta, we are going to have the vitiation of the when you think about Akasha and Vayu Mahabhuta plus Tejo Mahabhuta, the dominance may be observed when a person is having the exposure to these kinds of the Nidana. Suppose if we consider all the three Mahabhuta, they are of equal proportions, which is not at all happening in most of the occasions. In that particular situation, we are going to observe the 2x Vata Vriddhi because Akasha plus Vayu Mahabhuta, they are actually related with the Vata dosha itself. Hence, when a person is exposed to these kinds of the Nidana, Akasha and Vayu Mahabhuta, there will be the possibility of the vitiation of the Vata dosha up to 66%. Whereas when the person is exposed to the Nidana related to Agni Mahabhuta, there will be the vitiation of the Pitta dosha up to 33%. In the sense, 2x Vata dosha vitiation may take place and 1x Pitta dosha vitiation may be taking place. Of course, the identification of this, the percentage itself is a very difficult process because of the perception of the individuals, they vary. Even one individual also in the different time period that may vary regarding the Mahabhuta dominance and its exposure to the human body. When you think about the Shadrasa point of view, let us say there will be the Katu rasa, Tikta rasa, and Kashaya rasa. They are going to have the vitiation of the Vata dosha. Whereas Amla and Lavana rasa and Katu rasa, they are going to have the vitiation of Pitta. When you think about the Katu rasa as such, that is the common rasa, which is responsible for the vitiation of Vata as well as Pitta dosha. When the person is going to consume the Katu, Amla and Lavana rasa in equal proportions, then we are going to observe the vitiation of Pitta to the maximum extent, but the vitiation of Vata will be comparatively lesser. Suppose if the person is going to consume Katu rasa up to 60 or 70% and Amla rasa as the 10%, Lavana rasa as 10%, Kashaya and the Tikta rasa at 10 and 10%, then we are going to observe the vitiation of Vata dosha to the maximum extent, whereas Pitta dosha comparatively lesser. When you think about the Katu rasa itself, depending upon the, what do you say, see this, these are the different examples of Katu rasa substances. In all these cases, there will be the vitiation of the Pitta and Vata dosha is going to take place depending upon the degree of the Katu rasa dominance in these different substances. Depending upon that, we are going to observe the vitiation of the Vata as well as Pitta dosha. When you think about the rasa, the impact of this is specifically seen in the oral cavity. Whereas, when you think about the guna point of view, this may be observed depending upon the exposure of the percentage of these guna that may lead to the vitiation of Vata and Pitta. So here, let us say the person is going to consume the Laghu guna substances as such. For example, the person is going to consume the Laghu guna substances in the sense, naturally, these are common to Vata as well as Pitta dosha. Hence, we are going to observe the vitiation of Vata as well as Pitta. When you think about this is the image of a gobi Manchurian. So, this guna, the proportion of the guna that may vary depending upon the nature of the preparation of the, what do you say, that the gobi Manchurian. Some of the drugs we are going to prepare by the Sarshapataila. Some of the occasions we are going to prepare it by the groundnut oil. Some of the occasions we are going to prepare it by adding the red chili. In some of the occasions we are going to add the green chili, etc. We are going to add pepper, etc. We are going to, in this way, the percentage of the oil that is being used. Some of the occasions the gobi manchurian is being fried, wherein the oil is being used 3 or 4 times. In a sense, the percentage of the, what you say, that the Tikshna guna that may be comparatively much more in that particular situation. The percentage of the red chili, one chili that may have the mild Vata as well as Pitta dosha vitiation. Three chili that may lead to the uh, vitiation of Vata and Pitta dosha vitiation comparatively a little bit higher. And 5 or 6 chili, red chili consumption may lead to the vitiation of the Vata and Pitta even to a larger extent. In this way, we are going to analyze from the Guna point of view. When you think about the Guna point of view, this impact that may be seen in the alimentary canal, its impact may be seen in the intravascular compartment, its impact may be seen in the interstitial compartment, and its impact may be seen in the intracellular compartment. In this way, we are going to observe the mechanism of the Vata Pitta vitiation in the Vata Pitta dominant diseases. Let us say the example. It is being mentioned. Chatushprakara samshuddhi pipasa marutatapo pachanani upavasascha vyayamascheti lankhanam. When you think about this, Chatushprakara samshuddhi. So that is Vamana, Virechana, Asti, and Nasya. So these are the samshodhana therapies wherein there may be the possibility of the Laghu Guna increase in the body. Pipasa, wherein the person is going to have, when you say that the thirst, therein there may be a possibility of increase of Laghu Guna there. Maruta, exposure to wind, there may be the possibility of the increase of Laghu Guna is going to take place. Atapa, that is exposure to sunlight. Pachana, that is the medicines wherein we are going to observe the Amapachara there. Upavasaha, we are going to do the fasting. And Vyayama, we are going to see the exercises, etc. All these are responsible for the increase of the Laghu Guna in the body, but impact may be seen in different parts. For example, Vamana, wherein we are going to observe the Laghu Guna increase initially in the upper alimentary canal. Virechana, Laghu Guna increase is seen in the lower alimentary canal. Basti, wherein the Laghu Guna increase is seen in the large intestine. Nasya, by administering, the Laghu Guna increase is seen in the head and neck region. Pipasa, the Laghu Guna increase is being observed in the intravascular compartment. Maruta, Laghu Guna increase is seen in the skin and other as the associated structures as such. Atapa, Laghu Guna increase is seen in the skin, where there will be the initiation of the Pitta is going to take place, specifically Pachana, Laghu Guna increase is seen in the alimentary canal. Upavasa, Laghu Guna increase is seen sequentially in the alimentary canal, intravascular compartment, interstitial compartment, and intracellular compartment. So here, intracellular compartment, that too, in the adipose tissue, we are going to see the increase of the Laghu Guna. Thereby the person will be emaciated there. Vyayama, wherein the Laghu Guna increase is typically seen in the intravascular compartment, interstitial compartment, or intracellular compartment. In this way, we are going to analyze the mechanism of the Langhana and its impact on the initiation of the Vata and Pitta dosha there. As far as Katu Vipaka is concerned, for Vipaka point of view, Katu and Amla Vipaka, so that will be responsible for the abnormal vitiation of the Vata as well as Pitta. Whereas its impact is specifically seen in the alimentary canal. Rasa, specifically seen in the oral cavity and surrounding structures. Vipaka, it is seen in the alimentary canal. The two, its impact is seen in the small intestine as well as large intestine. Virya point of view. Ushna Virya is specifically highly active in this particular situation. Here, the abnormal increase of Vata as well as Pitta is going to take place initially in the alimentary canal. Then there may be the possibility of the Vata Pitta vitiation in the intravascular compartment, later in the interstitial compartment, and at last seen in intracellular compartment. In this way, impact of the Vata Pitta vitiation in Ushna Virya substances we are going to observe in any part of the body. When you think about the Prakopa Karma point of view, so here we are going to see the Vata Prakopa Karma, that is the Vyasa, that is dilatation of the blood vessels, that is the varicosity of the blood vessels, specifically veins are being seen. Plus, we are going to see the Kotha formation in the lower limb. So, in the sense, we are going to see the Prakopa Karma of Vata as well as Pitta. For this, you need to know about the Vata Prakopa Karma. Sramsavyasa Vyadhaswapa Sadaraktoda Bhedanam Sanganga Bhanga Sankocha Varta Harshana Darshanam Kamba Parushya Sausirya Shosha Skandana Vishtanam Stamba Kashayana Sata Varana Shavu Arunopiva Karmani Vayoho Ashtanga Hridaya Sutrasthana 12th chapter. When you think about the Pitta Prakopa Karma, Pittasya Dahara Doshna Pakitaha, Sweda Kleda Sutihi Kotha Sadanam Murchanam Badaha, Katukamla Rasovarana, Panduraruna Varjita. So here we are going to observe the Prakopa of Vata as well as Pitta Dosha is going to take place. When I think about the clinical features point of view, we are going to see the Vata Vritti Lakshana as well as Pitta Vritti Lakshana we are going to observe. For example, here the example is being given alcoholic liver disease, wherein there will be Vata dosha initiation that is being observed, specifically related to the emaciation is going to take place, wherein the fat mobilization will be taking place from the adipose tissue because of less consumption of the carbohydrate. Therein, there will be the fatty degeneration of the liver, which in turn leads to cirrhosis of the liver, which in turn leads to the hepatocellular jaundice, wherein we are going to observe the both Vata as well as Pitta dosha vitiation is going to take place. So here we are specifically we need to know Vruddhastha Kurtenena Karshya Karshnoshna Kamitva Kampana Shakrigrahan Balanidrendriya Bhramsha Pralabha Brahmadinata Pita Vinmutra Netratva Kshatridaha Nidrataha Pittam Ashtanga Hridaya Sutrasthana 11th chapter. We have to know about these Lakshana and their physiological impact and pathological impact we need to understand from the clinical features point of view. Sthana point of view, when you think about it, it is being mentioned the Pakvashaya Kati Sakti Shrotrasti Sparshanendriyam. When you think about the Pitta Sthana, Navirama Svedo Lasika Rudhiram Rasa Drik Sparshanam Cha Pittasya. So that means we have to inquire the dysfunction related to any of these organs. Pakvashaya dysfunction, Kati dysfunction, Sakti dysfunction, Shrotra dysfunction, Asti dysfunction, and Sparshanendriya Tvak dysfunction has to be noted. We have to note about the dysfunction related to Nabhi, Amashaya, Sweda, Lasika, Rakta, the Rasa, Drip, that is eyes and skin. All these has to be inquired. We have to know about at least one or two main dysfunction related to these organs has to be inquired when you want to identify the mechanism of Vata Pitta disease. In terms of the Udbhavasthana, Pakvashaya or Adho Amashaya may be responsible for the dosha initiation start. If the person is having the Vata dosha initiation first, so that will be responsible for the Udbhavasthana as Pakvashaya. If Pitta dosha initiation starts to occur, in that particular situation, Udbhavasthana need not be Pakvashaya, it is Adho Amashaya. In this way, depending upon the manifestation, the first symptom, we can able to identify the Udbhavasthana involved as either Pakvashaya or Amashaya. There need not be both the Udbhavasthana, the Amashaya as well as Pakvashaya need not be taking place simultaneously. Or Amashaya and Pakvashaya, that is the Udbhavasthana as well as the Amashaya and Pakvashaya, they are not going to take place simultaneously. That's how we are going to understand from the Udbhavasthana point of view. From the Nidana point of view, let us say the person is doing the cycling. The person is doing cycling in the summer season. Depending upon the nature of the Nidana Sevana, degree of Nidana Sevana, we are going to observe the initiation of the two dosha in different proportions. For example, if the person is doing the one round of cycling at around 7 a.m. in the month of May, we are going to observe the Vata dosha initiation to the maximum extent. Pitta dosha initiation is going to take place lesser. In the If the person is going to do the cycling of 4 rounds at around 4 kilometers in the month of May at around 11 p.m., there may be the possibility of Pitta dosha initiation maximum and Vata dosha initiation may be little bit lesser. Cycling more than 10 kilometers at around 2 p.m. in the month of May, there will be the initiation of Pitta dosha to the maximum extent, whereas Vata dosha comparatively lesser in that kind of situation. In that way, the Bala Samprapti is helpful in making the Vata Pitta diagnosis as such. When you think about the Bala Samprapti point of view, it is even mentioned that from the point of Rupa, we have to know about, as we have discussed earlier, वृद्धस्त गुरुते नीला कार्श्य कार्ष्णोष्ण कामित्व कंपानाश कृद्ग्रहण बल निद्रेन्द्रिय भ्रंश कलाप भ्रमदीनताः पीत विमुत्र नेत्रत्व क्षुद्रदाह निद्रताः पित्तम. We have to identify the but we say that the initiation of these either Vata or Pitta, sometimes even the Kapha dosha, there may be the possibility of initiation. We have to analyze these accordingly. Nidana point of view. For example, if the person is going to consume the vada pav, when you think about that, vada pav as such that is containing the potatoes, wherein there may be a possibility of vata dosha initiation, that is being fried in the, if that is being fried in the sarshapataila, there may be the possibility of pitta dosha initiation. In that way, if the person is going to consume the vada pav more than 3 or 4 vada pav at a particular time period, so here the source of the entry of the pathogen is going to take place via oral cavity. In that way, there will be the possibility of the vata dosha initiation is going to take place in the alimentary canal. Suppose if the person is going to consume the vada pav, and in that particular situation, the one small piece of the vada pav is entering into the nasal cavity. In that particular situation, the source of the entry of the pathogen is going to take place into the nose. In that particular situation, the person may have sneezing, etc., or cough, etc., that is going to take place. In that way, the depending upon the nidana, as such, there will be the initiation of the vata or pitta dosha in the body. To sum up, vata and pitta dosha dominance is observed depending upon the exposure to these different aspects. That is, exposure to the nidana, that is responsible for the increase of akasha, vayu and tejo mahaduta in the body. There may be the possibility of abnormal increase of vata and pitta. Exposures related to katu rasa substances based on the rasa dominance. Exposures related to the guna, specifically related to laghu guna increase in the body, that will lead to the abnormal initiation of vata or pitta, vata and pitta in the body. Exposure to the nidana, which are having the shita and ushna virya in particular, and if the person is having the exposure to katu and amna vipaka, there may be the possibility of vata and pitta dosha initiation. We have to know about the lakshana, prakopa karma. It is being mentioned that the Sramsa Vyasa Vedaswapa Sadarupto the Vedaram Sandandamanga Santoja Varta Harshana Prashanam Kampa Parusha Saushiri Shushraspandana Veshkaram Stambah Kashayarsta Varanashavu Arupiva Karmani Vaya Pittas Daharago Supakita Sveda Teras Tehikotaha Sadanam Chanam Pada Kadgamna Usavan Pandarana Vadita. We have to know about these applications, then we can able to understand the Vata and Pitta Dosha initiation there. Observing the dysfunction related to Pakvashaya or Adho Amashaya, we can able to analyze the Uttavasthana of the Vata Pitta dominant disease. Observe the locations of the Vata and Pitta Dosha dysfunction. That is, Pakvashaya Kati Sakti Shrotra Sparshana Sthanam Vata Chitra Pakvadhanam Visheshatah. These are related to Vata Dosha Sthana. नाभिरामाशयो स्वेदो लसिका रुधिरप्रसः दृक्स्पर्शनं च पित्तस्य नाभिरत्र विशेषतः. These are related to the Pitta Dosha Sthana. We have to inquire the dysfunctions related to these sthana has to be analyzed properly by doing the careful analysis of the samprapti, maybe in terms of the bala samprapti, maybe in terms of the vikalpa samprapti, maybe in terms of the kala samprapti, etc. We are going to analyze the mechanism of Vata Pitta diseases by doing the careful analysis of Nidana related to Vata and Pitta dosha dysfunction. व्यायामाद पतर्पणात् प्रपतनात् भंग अक्षयात् जागरात् वेगानां च विधारणात् अतिशुचः विद्यादतित्रासतः वृक्षक्षोभकषायतिक्त कटुकेरैः प्रकोपं प्रजेत् आयुर्वारिधरागमे परिणते चान्यपराङ्गे अपि च. These are the Vata प्रकोपकारणम्. कट्वं लोष्णिग्राहि तीक्ष्ण लवण क्रोधोपवासाः स्त्री सम्पर्कतिलातिसि दधिसुराशुक्तारणालादिभिः भुक्तैर्यते भोजने च शरदे ग्रीष्मे सिद्धि प्राणिनां मध्याह्ने तथा अर्धरात्रिसमये पित्तं प्रकोपं व्रजेत्. These are the Pitta dosha प्रकोपकारणम्. We have to analyze these appropriately, then only we can able to understand the mechanism of the Vata and Pitta dominant diseases, its pathogenesis. Dear ANA community, that's all for today. What are the major key takeaways from today's discussion? Mentioned in the comment box below. What is the one benefit active in the coming days in this particular channel? Mentioned in the comment box below. And spread this particular video to maximum number of learners so that we can make a huge movement out of this particular student message. Don't forget to press the bell icon so that YouTube algorithms will be fetching with the right information with the right time from the right buttons. That's all for today. Something more in the next video. Thank you.